Hello and a very warm welcome to the brand new edition of To The Point. I'm Kriti Mishra. And on today's show, my guest is President of Public Health Foundation of India, Professor K. Srinath Reddy. Professor Reddy, welcome to Rajya Sabha Television and thank you so much for joining us.
Thank you.
The COVID-19 cases have reached 1 lakh mark in India. How will the situation evolve now? What is your assessment of the spread of the infection?
Well, we have to differentiate between cases and the consequences. The case count is bound to rise, particularly with increased testing. As we keep ramping up our testing rates, we are bound to have more cases diagnosed and hopefully well treated and recovered. But what we need to keep an eye on are the deaths. If we can actually keep our death rate low and keep the rate of rise of deaths slow, then that is success. Ultimately, our mission is to reduce the total number of deaths and save lives. So having the cases rise is not a matter of great concern if we can actually control the consequences.
And perhaps India has kept the mortality rate low, sir?
It has. In fact, right now, if you take the mortality rate for the whole population, then it's about 2.3 per million, which is at least 100 times less than that of the United States and even lower than some of the European countries. And more importantly, if you take the different phases of the lockdown, first 15 days, the next 15 days, and the last 15 days, and keeping in mind that this is an exponential growth, actually the rate of rise of deaths has actually become slower over a period of time, both for the 15-day intervals as well as the daily rates. So to that extent, we can see the impact of the lockdown in at least curbing the deaths, even while the cases are rising in number, as expected with more testing.
Professor Reddy, you have corroborated the idea of exiting the lockdown. But I'd just like to understand what should be the strategy to strike a perfect balance between lives and livelihoods.
Well, we do need to maintain public health priorities as the topmost concern. But recognizing firstly that there is a law of diminishing returns, that if we continue the lockdown too long, it has adverse consequences for the economy, a number of social sector elements like school education, for example, and even for health, because there are a number of other health priorities will get neglected if the preoccupation is wholly and solely with COVID-19. So now that we have achieved the objective of firstly slowing down the death rate and keeping it under fairly good control, we've started increasing our testing rates so that we can get better recognition of the infected cases and isolate them. And we have also built up our health systems to greater capacity and mobilized our social response as well to cope with some of the issues related to displacement of people. I think it's time for us now to get back out of the lockdown into a return, not to complete normalcy as before, but with substantial precautions to prevent the spread of the infection so that we continue to keep the rate of deaths as low as possible.
And what is the substantial precaution that you're suggesting or hinting at, sir?
Well, firstly, at the level of the individuals, we have to make sure that there is a level of individual protection for ourselves from getting infected. And should any person be infected, for that person not to infect others. Considering that this is a droplet infection, we know that a portal of entry is the nose, the mouth, or even the eyes. It can actually enter the eyes, and because there's a connection between the eyes and the nose through the nasolacrimal duct, the virus can even go to the nose from the eyes. So the most important thing is to have physical distancing so that the droplets from somebody else do not fall on your face, or your droplets will not fall on somebody else if you cough. And secondly, to make sure that the face is adequately protected so that those droplets, even if they land in the area of the face, do not actually enter these three doorways of entry. And third, make sure that your hand hygiene is frequent in terms of washing hands with water and, if possible, with soap, so that if you have picked up the virus from any object, you're not actually touching your face with the same hands. You keep washing. So those are very important. But the second element is to strengthen our surveillance system so that we can identify new cases and not just testing, but also syndromic surveillance. which means that based on the 7 symptoms that have now been identified by CDC, which of course have three main areas, that is cough, fever, and breathlessness, but additional symptoms have now been added as well. We can have household surveys by frontline primary healthcare workers supported by community volunteers, and those who are reporting symptoms can be then investigated by the medical teams. Mostly, if they're mild or asymptomatic, they can be isolated at home after testing, and if necessary, if they're seriously unwell, then to be taken to a hospital. So these kind of systems also must evolve now to keep track of the cases that are emerging. And while we are taking personal precautions, the primary healthcare system also must be greatly activated.
Professor Reddy, given our size of population, how do we ensure that there are sustainable levels of testing protocols in India?
Well, I think we have to first define who are the people to be tested. I don't think we can really talk about mass testing. Neither it is feasible nor is it necessary. It has been clearly pointed out everywhere that there are certain indications clearly for testing. Those who have symptoms must be tested. Previously, it used to be people with serious acute respiratory infections. Now, even people with influenza-like illness can be tested for this. Once our testing kits are available in larger numbers and there are more labs available. But essentially, it is symptom-guided testing. Then, of course, people with travel history, either from abroad, now if the flights resume, or from hotspots to other areas, they probably need to be assessed clinically and, where necessary, tested. Then, of course, healthcare workers who are constantly in contact with infected patients, they need to be tested as well. So these are the categories that we need to test. And we can't go around testing everybody in a haphazard manner on the street. That's not necessary, that's not feasible. But we need to develop these kind of protocols so that we optimally utilize our testing facilities through an appropriate strategy.
Right, sir. But right now, the major concern is stopping the spread from urban to rural areas. What is the key, Professor Reddy?
Yes. Well, I think our rural areas are much better protected. Firstly, because there's much lower level of exposure from foreign return travelers or their primary contacts. Secondly, even if the virus does perchance enter the rural areas, spread from person to person is not going to be as rapid as in an urban environment where there's far greater mobility. There's much less mobility in the rural areas. Therefore, the infectivity rate of the virus itself, what's called the R naught in technical terms, is going to be much lower in rural areas than in urban areas. But having said that, it's in our interest to protect the rural population from undue exposure, which means that we try and restrict the communication in terms of transport of goods as well as other travels to absolutely essential needs. So, travel for essential needs and transport of essential goods so that we can actually continue to protect our rural areas from urban ingress of the virus.
Absolutely, sir. But many experts have been recommending that herd immunity strategy for India as a country because we have a significantly young population. Your take on it, Professor Reddy?
See, firstly, herd immunity requires at least 60 to 70% of the people being exposed throughout the country for this particular virus. We do not know whether it will be more or not because highly infectious viruses sometimes require even up to 80 to 90%. But we know from even other countries which have had huge outbreaks of this epidemic that only about 5% of the population at the most have been exposed. So for 60% of the people to get exposed throughout the country is going to take a long time.
Right.
Second is, it is actually herd protection. Now, if I'm in Delhi and if 60% or 70% are infected, then the remaining 30 or 40% get protected because the virus stops transmitting to them because the others have blocked it because of their immunity. But if anybody from that 30 to 40% who is unprotected travels to Ranchi or Raipur, where the levels of protection, immunity exposure may be only 20 or 30%, then that person is still susceptible when they go there. It's not as though a person who is uninfected from Delhi is going to be immune wherever he travels in India, unless everybody in India, every place in India has reached that 60 to 70% threshold. So that's going to take a long, long time. Plus, there is also uncertainty about the virus mutating. So I would not place all my bets on herd immunity at the moment.
And some experts also suggest that COVID 19 cases may peak in India in June or July.
Well, we do not know yet. We see, it depends on what you mean by peaking. If you are going to be only looking at testing rates, the more you test, the more cases you will find,
Right.
even if they're asymptomatic. Ultimately, it's going to be what we want is a slow and controlled exposure over a period of time with very few deaths. On the other hand, if you say that the deaths are going to fall, right now, if you see the United Kingdom, Italy, Spain, the way they are reporting is the death count per day has begun to fall. So now they say we can now sort of loosen up. So we have to keep track of the deaths rather than just on the case count, which is extremely variable and dependent on the testing rates.
But sir, there's also a major concern about the second wave of coronavirus or COVID 19.
Well, possible. We cannot rule it out. This is a new virus. We don't know how it's going to behave, and particularly in terms of the winter or even other months before that, we do not know during the influenza season how this virus is going to behave. However, there are two reasons for us to be hopeful that temperature rise and humidity may actually bring about a slowdown in this virus, like for other coronaviruses. We'll have to wait and see. But there is another reason why we must maintain our containment measures like physical distancing as well as masks, etc. Because if you actually prevent the virus from moving around freely from person to person, the viruses also tend, after a period of time, to mutate to a less virulent form.
Yes.
So we are actually limiting its ability to move. Therefore, by pure evolutionary biology, it tends to become less mild because it also has to retain its species somewhere around. So I think it is absolutely important both for our own protection as well as for nudging the virus to become become less virulent by sort of hemming it in. That's going to be an important element.
So, your suggestions to the state government to prevent a sudden surge.
Well, I think the important thing is never to let the guard down so that we actually continue to maintain all these distancing measures as well as personal protection measures and syndromic surveillance, which are symptom based, and tracking cases. All of that is going to be important as we move along. But we have to now move from a countrywide strategy to a micro planning strategy where we actually look at each ward in a city and cluster of houses in a village and plan accordingly. Look at what is the outbreak rate over there, or is it getting contained there? How can we actually engage the community in community based surveillance, including case reporting, isolation, and supportive social services? So ultimately, what's going to happen is that we need people partnered public health and a very restricted level of micro planning and micro implementation. It's not even district level. We have to go down further down, particularly in rural areas, there'll be a different plan. In urban areas, there's going to be a different plan. So the more we can actually have a decentralized implementation, even if policy is centralized and planning is at state level, the actual implementation has to be at the district and sub-district level.
And what is the kind of role of the private sector that you foresee now?
Well, the private sector, we'll have to divide it into the healthcare private sector and the non-healthcare private sector. From the healthcare private sector point of view, I would say that they have to now pitch in with the government and become a responsible partner in trying to implement, because particularly at all levels of care, primary as well as advanced care, we need to bring in all our assets, public sector as well as private sector, together to provide a response. So this is not the time for us to be now having disputes over payments and so on. We have to really step forward and work as a common front, whether it's testing or treatment. But there is also a role that can be played and is to be played by the non-health private sector. Firstly, in producing more equipment, not only for laboratories, for ventilators or whatever, but most importantly for supporting our primary healthcare services in terms of expanding the capacity through appropriate technologies for contact tracing, for other supportive measures. So private sector has to become much more innovative from that point of view, not focus just on ventilators. Very few are going to be needed, but focus on a lot on primary healthcare and what kind of appropriate technologies are there. Further on, they can also help by reducing the pollution levels, because it's known world over that where the air pollution levels are higher, the mortality is also higher.
Right.
So we need to also refashion our future, and the private sector has a role to play by becoming responsible citizens and learning the right environmental lessons, which will help us, and not only from COVID-19, but from other potential health outbreaks.
That's a very important point that you're making, Professor Reddy, but also the fact that monsoon is around the corner. How do we ensure that there's also undivided focus on other diseases other than COVID 19?
I entirely agree that we cannot afford to neglect other diseases. There's no question about it. A responsible health system is not going to be only focusing on one single priority, however important this public health emergency is. There is the whole area of maternal and child health, there is the area of non-communicable diseases like diabetes, hypertension, the area of mental health. All of these are important. And other infectious diseases too. Tuberculosis. We announced that we are going to be eradicating tuberculosis by 2025. And now we have to get onto that job of dealing with tuberculosis as well as dengue, chikungunya, and everything else as we move along. So that is where I think we are paying the price for our past neglect of our health system, not building a sufficiently strong public health workforce, not building strong primary healthcare systems, not building district hospitals in several states to the level that they are required. But even if we can't do that by this rainy season or monsoon, we have to keep this lesson for the future. But in the immediate short run, I think we have to bring in a lot more community participation to strengthen our public health and primary health care efforts. Kerala has shown wonderfully how that can be done. Even some other states like Odisha and Andhra Pradesh are doing it fairly well. So I think these are the lessons we must learn, so that without people partnered public health, you're not going to really achieve the kind of health gains that we really need, whether in COVID or in other areas of health challenges.
Absolutely, sir. But do you also think that there's a dominance of a particular type of strain of coronavirus, and that could be the reason behind surge in the symptomatic cases?
It's possible because we are seeing some strains, but both WHO and ICMR say right now there is no clear cut evidence of change in the virulence of the virus itself. We'll have to wait and see as more data accumulate. It's a little early stage to speculate unless we have a lot more data. But whether some of the strains and the mutations are actually responsible for different behavioral patterns of the virus, we do not know. But we do know that the viruses do change. They have minor mutations and major mutations depending upon how rapidly they can spread or how their spread can be contained. They can grow more virulent or less virulent. It is in our interest that we actually push it to become less virulent through all the measures that we take, including not giving it a free road to travel. We should not leave an open highway for the virus to travel. We should create a bumpy road for it to travel.
Absolutely, sir. That's a very important point that you're making, that we have to create a bumpy road for it to travel. But the most important part here is development of a vaccine. Professor Reddy, you're a member of the executive group of the International Steering Committee of WHO's COVID 19 Solidarity Trial. Across the world, over 100 vaccine candidates are racing against time. Where do we stand in terms of developing the vaccine, and what is the kind of role that you foresee for India?
Well, the solidarity trial has two components. One is on drug trials for treatment, and the other is on the vaccine trials. I'm part of the drug trial group. But nevertheless, there are a number of candidates who are vying for the possibility of becoming the vaccine or one of the really most effective and safe vaccines to emerge. Now, a vaccine has to be not only efficacious in prevention, but also it has to be safe as well, particularly if it's going to be used across the world. Now, there are claims that some vaccines will be available after the initial stages of testing by September for going into the next major phase of clinical trials and then into production phase. Now, we are still to await what those results will be because it's too early to guess. But if there are several candidate vaccines, it is likely that some of them will turn out to be promising, at least in providing a immunity for more than a year, because we do not know whether the virus will mutate or whether the coronavirus has antibodies which will sustain over several years. We still do not know about this new virus. Nevertheless, for us to have some degree of assurance that there will be at least some protection for a year or more, and that it's going to be also safe, I think we'll have to wait and see which of these 100 vaccine candidates will actually turn out to be winners and then choose among them. But whichever is the winner, and I hope there'll be a few, not just one, India has the production capacity to really produce vaccines for the world. And that is where I believe, whether it's an Indian vaccine or an international vaccine, the world will turn to India for its huge production capacity at low cost.
Absolutely, sir. Keeping our fingers crossed for it. But before we end this conversation, Professor Reddy, the road ahead seems long. Tell us, how do we get accustomed to this new normal?
We'll have to ease ourselves back to a new reality where we resume our activities, both economic and social. Like, we can't stop children from going to school, that's absolutely not permissible, or even important economic activities will reduce, but with adequate protection in terms of the public health measures. But I've been a cardiologist before taking up public health as my main passion. So when somebody gets a heart attack, they need some rest initially, but you don't delay it too far. You want early rehabilitation as well. But that rehabilitation does not mean the person after a heart attack starts jumping out of the bed and dancing the very next day. So the whole idea is to phase back into different levels of activity over a different period of time, over various periods of time. The same way, stepping back into normalcy in stages, and they will be differentiated. There will be parts of the country which are very safe or getting much safer. They can resume faster. There are parts of the country which will require longer time to get back into that level of normalcy. But it has to be done in a staged, differentiated manner with some degree of patience, perseverance, and confidence that we will overcome.
So, cardiology and COVID 19, that's the perfect analogy that you could put across to us and to our viewers. But, Professor Reddy, it was pleasure talking to you, and thank you so much for giving us those details and also joining us on Rajya Sabha Television in this era of social distancing through Skype. Thank you so much, sir.
Thank you very much. It's been a pleasure. And I hope the country will benefit from this interaction, and that we will all be able to actually communicate with greater confidence in the months to come. Thank you.
Thank you, sir.